Hello, good evening, everyone. Welcome to OET Speaking Speculation Live. This is me, 𝐒𝐲𝐞𝐚𝐤𝐬, joining you from Neethu's Academy. So, yes, good evening, everyone. Welcome back to another live segment. Yes. Alright, so ഇന്നും നമ്മൾ ഒരു റീസെൻറ്റ് എക്സാം മോഡൽ കാർഡിൻ്റെ ഡിസ്കഷൻ തന്നെയാണ് ചെയ്യുന്നത്. സോ മേക്ക് ഷുവർ ദാറ്റ് യു ടേക്ക് എ സ്ക്രീൻഷോട്ട് ഓഫ് ദിസ് കാർഡ് ആൻഡ് റിമെമ്പർ ദാറ്റ് യു നീഡ് ടു പ്രിപ്പയർ ഇറ്റ് വെൽ ഡ്യൂറിങ് ദ 3 minutes time that I will be providing, and after that you need to perform, give me the sentences through the comment section. Like I'll be telling the sentences, or I'll be disclosing how each task can be done from my end, and from your end what you have to do is to send me the sentences. You have to construct it and communicate with me via comment section. Okay, so just a heads up for everyone, I'll be using both the languages, English and Malayalam. So if there are any non-Malayalis watching this segment, please don't worry, you will be hearing everything in English as well, so you don't have to worry about me talking in Malayalam. So whatever I'll explain in English, I'll just translate that to Malayalam for the non-Malayali and Malayali viewers as well. Okay, yes, good evening all of you. Which you are providing the details back to the patient. So this is the context here. So without wasting much time, let me share the card for you guys. So remember, you have 3 minutes to prepare the card, and after that we'll have a detailed discussion. Okay, so over to the card right now. Alright, welcome back everyone. So I hope all of you have gone through the card. You got an idea about how this card can be done. What are the points that you need to look into, how to prepare it, the introduction, what is the organization that you need to follow here, the transition points, that means how to move from one point to the next point, and also how to end each task. Like every task will have to have a proper start. At the same time, it requires a proper finish also. So you need to make sure that you're planning which type of question should be used before you do the transition, depending on the task's nature, whether it needs to be checking the understanding type of question or whether it needs to be checking how the patient feels about your suggestion type of question. So based on the nature of the task, you need to prepare that. ഇതെല്ലാം സ്കോറിനെ അഫക്റ്റ് ചെയ്യുന്ന കാര്യങ്ങളാണ് എന്ന് നിങ്ങൾ റിയലൈസ് ചെയ്യണം. ആ ഒരു പോയിന്റ് മനസ്സിൽ വെച്ചിട്ട് വേണം പ്രിപ്പയർ ചെയ്യാനായിട്ട്. ഓക്കെ, so you might have heard while you're doing the role play by yourself or when you listen to others doing the role play, you might have heard people asking the questions like, how does that sound to you? Is that okay with you? Is that clear to you? Are you following what I'm saying? These types of questions are not just basic questions to just show the flow of the conversation or to just add some beauty to your conversation. These are parameters which are also going to reflect your score, because when you ask the question, is that clear to you? Are you following me? Did you get my point? You're checking the understanding of the patient, which is one of the parameters under information giving. Okay, you're giving information and it is clearly mentioned in your assessment criteria that you have to check whether the patient is following what you have just mentioned. At the same time, on the other hand, if you ask the questions like, how do you feel about it? Will you be able to do that? How does that sound to you? Okay, you ask these types of questions after you provide an instruction, like you give a suggestion or a recommendation about what to do, what not to do. So when you give these types of instructions and suggestions or recommendations for that matter, you need to either ask whether the patient is clear with what you recommended, or you can ask whether the patient is feeling okay with it, like whether the things are sounding feasible for the patient. So these types of questions are coming under the category, check how the patient feels about it. Okay, so when you do these things, these are not just random questions that you're doing in the role play because you've been instructed to do it. No, you need to understand the purpose, the meaning of why it is needed in the role play. It is actually a part of the parameter. So these small questions are crucial. You need to be making sure that you have planned which question to be used to finish off one particular task. ഒരു particular task എടുത്താൽ അതിൻ്റെ നേച്ചർ അത് ഇൻസ്ട്രക്റ്റീവ് ആണോ എഡ്യൂക്കേറ്റീവ് ആണോ എന്ന് മനസ്സിലാക്കി അതിന് സ്യൂട്ടബിൾ ആവുന്ന രീതിയിൽ അതിനെ എൻഡ് ചെയ്യാനുള്ള സ്മോൾ ക്വസ്റ്റ്യൻ ഡെവലപ്പ് ചെയ്യുക എന്നുള്ളത് ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ള ഒരു കാര്യമാണ്. ദാറ്റ് ഈസ് സംതിങ് ദാറ്റ് നീഡ്സ് ടു ബി done properly during your 3 minutes preparation time, because I have personally seen a lot of students getting stuck thinking about, okay, how will I finish this task? What should I do to move on to the next point? Okay, ingane stambichu ninnu povarundu. So do not put yourself in a situation where you are stuck or you are thinking too much about what can I do right now? How should I finish it off? I just completed all the points. Now what is the next thing I need to be doing? No. So these hindrances can be easily eliminated if you have a pure cut or a clear understanding about, okay, this is how I'm going to end this task. This is an educative task, so I'm going to check whether the patient is clear with what I just mentioned, or the patient is clear with all the information that I have given. At the same time, if we're given instructions like recommendations, suggestions, advice, so and so, like pre-operative instructions, post-operative instructions, or after discharge care and things like that. So these are the points which include the information about what to be done and what not to be done. So when these things are given, it is important that you check with the patient whether the patient feels okay with it, whether the patient thinks, yes, I can do it, this is doable, I don't feel much difficulty here, whatever the patient feels about it. It's important that you check with the patient about this as well. Okay, this is called checking the understanding of the patient. So remember that you incorporate these things based on the type of task that you have, and you need to pre-plan this. Along with this, you need to also look into the transition. Sometimes there would be some transitions given on the card itself. You do not have to do the transition from your end. You can see the transitions given there on your card, like find out any questions or concerns. So automatically the card itself is telling you this is the transition you can apply. to move on to the next point. So you can try that. Okay, at the same time, it is important that you plan all these things, because getting stuck is not a joke. I have personally seen and also heard from the students what they face as a biggest challenge is that they get stuck. Their ideas ran out or they go blank while they're speaking. So you actually get a very sharp break in between, and you will be thinking like, okay, what is the next thing? How should I move on to the next point? So these long pauses are quite unnecessary, and this can affect your score really badly. So make sure that you're pre-planning about how to move to the next point. It is important that you're planning the transition. Okay, so these are a couple of things that you need to be doing during your 3 minutes preparation time. So now let's look into this card and check the details. So make sure that whenever you are discussing cards, be it your one-to-one sessions or be it the live or the speaking club that you're attending to, make sure that you are noting down the different contexts, okay, that you're coming across. So in this case, we can understand which context this is, and when you have an understanding about, okay, this is this context and this is this nature, you should be telling yourself, okay, so my card, if it is like this context, this is my introduction. If it is this context, this is my initial assurance. If this is this type of task, then I need to do it like this. So you need to have a proper strategized learning. It's not just about getting your feedback, just listening to your trainer like, okay, you should do this task like this task can be done like this. എന്നുള്ള ഒരു ഇൻഫർമേഷൻ മാത്രം നിങ്ങൾക്ക് പോരാ. That's not enough. Okay, you need to understand that, okay, this task can be done like this. So the next time when I come across a similar context like this is how I'm going to do it. ഇങ്ങനെയേ ഞാനത് ചെയ്യുള്ളൂ. ഇങ്ങനെയാണ് ലാസ്റ്റ് ടൈം എനിക്ക് കറക്ഷൻ കിട്ടിയത്. ഇതാണ് strategized learning. Okay, so always remember to do this. Okay, yes. So good evening Adra, Asha, Suma, Jubi. Yes, welcome back all of you. So without wasting much time, let's get started. So the first point that you need to understand when you look at the card is to identify which type of context you're dealing with. You need to have an idea about whether this is going to be a known case or an unknown case. So now Suma has commented this is an unknown case and this is a first category case. Okay, so Suma, there is no first category, second category for unknown cases. It's just for the known case scenarios. Okay, so how did you understand this is an unknown case? That's my question. Yes, this is an unknown case. Adira also mentioned this is an unknown case. Okay, guys, let me make it clear to you. She also mentioned first category in the comment section. There is no first category, second category for unknown cases. It's just unknown case. Okay, first category, second category is for your known case scenarios. Okay, with unknown cases, we don't have the first category context cut off. So don't get confused with it. So in this context, yes, this is an unknown case. Can you comment down why do you think this is an unknown case? Yes. What makes you think this is an unknown case, or which information gave it out to you? Yeah, this is an unknown case. All right. Let me know in the comment section. Which portion? When you look at the first task, you can see find out the reason for the patient's visit. So I have told you multiple times, be it in the speaking club or the lives that we do here, whenever your first task is to find out the reason for the visit, that basically tells you the logic. This is the first time you're talking to this patient. Okay, so in this context, yes, you can see some information is given in your background details, like we know the age of the patient, we know what is the problem that is affecting the patient, we know what the patient is here for, and everything is mentioned. But if your first task is ask for the reason for the visit or find out the reason for the visit, the background information is called contextual information in these types of cases. Okay, you don't have to think about, okay, I have so much information about this patient, so yes, this is definitely going to be non-case. That is not the right way to approach it. So if your first task is find out the reason for the visit, നിങ്ങളുടെ ഫസ്റ്റ് ടാസ്ക് എന്തിനാ വന്നിരിക്കുന്നത് എന്ന് ചോദിക്കുന്ന ടൈപ്പ് ഓഫ് ടാസ്കുകളാണെങ്കിൽ കണ്ണും പൂട്ടി നമുക്ക് എന്ത് പറയാം, അൺനോൺ കേസാണ്. Okay, so now in this context, yes, this is unknown case. So yes, let me know what are the steps that you need to do the introduction. I'm pretty sure you guys are very familiarized with this concept because ഈ ഒരു 5 സ്റ്റെപ്പ് ഇതിനകത്തുണ്ട് എന്നുള്ളത് നിങ്ങൾ പലപ്പോഴും കമൻറ്റ് ചെയ്തിട്ടുള്ള കാര്യമാണ്. എസ്പെഷ്യലി യു, ജുബി, സുമ, അതിര, നിങ്ങൾക്കൊക്കെ ഇത് കോമൺ ആയിട്ട് അറിയാം because I am pretty sure that you guys been not missing even a single live and you've been always commenting down these points to me. So I'm pretty sure you all remember it and know it. So yes, we have 5 steps involved when it is coming to your your unknown case situation. So the first step that you need is your greeting. The second step is you need to introduce yourself, like say who you are. Third step is you can ask for the reason for the visit, like hey, why are you here? Okay, so you can ask, yes, hi, good morning, my name is so and so, I'll be taking care of you today, or I'll be attending you today, so may I know the reason for your visit? Okay, so this is how you'll be asking. And when you hear the reason for the visit, the very next step is to provide initial assurance. You have to tell the patient, oh, I'm really sorry to hear that. But be careful if the patient tells you, I'm here to get some information about the vaccine. You should not tell your initial assurance as, oh, I'm sorry to hear that. No, there is nothing to be sorry about, okay? The patient came for a good thing. The patient is not sick. The patient has just queries about some, she needs some details about the vaccine. So it's not a situation to be sorry about. So do not use, I'm sorry to hear that as your go-to initial assurance statements. You need to be using your logic. Be actively listening to what the patient is saying, and based on that you have to give out your initial assurance. If it is quite upsetting, if the patient is suffering from some problem, and if the patient is going to a rough patch of time, then it's okay to say, I'm really sorry to hear that. That's absolutely fine because the situation is a little depressing on the patient's end. But if it is not, if the patient has come for information gathering, if the patient is there to know more about, blood donation or to know more about vaccinations, it's a good thing the patient is doing. So what you have to do is you have to acknowledge that good thing instead of saying, oh, I'm really sorry to hear that. Do not make it a go-to statement. Okay, now in this context, let's see what the patient has to tell you. So if you ask, may I know the reason for the visit? The patient is going to tell you, hi nurse, so I recently retired from a job, and I'm a very active person. I engage in physical activities, I take care of myself really well, and I do sleep really well at night as well. But I wake up with cramps in my calves, and it is actually disturbing my spouse. So I'm literally worried about what is the problem with me. Why am I experiencing all these problems all of a sudden? So this is a long explanation given by the patient. So what should be your next point? You should be like, oh, I can understand that you are having some issues, or I can understand that you're going through a rough time right now, so let's look into it. Okay, or you can say, oh, I'm really sorry to hear that, but please don't worry, you have reached the right place. Let me look into it. I'll do the needful. Let me take care of it, or we will be there to help you, or something like that. So always remember, your initial assurance is a combination of 3 things. And what are those 3 things? Please let me know in the comment section. What are the 3 components that you need for your initial assurance? എന്തൊക്കെയാണ് ആ 3 components ഒന്ന് കമൻറ്റ് ചെയ്തേ. Jubi, greeting, self-introduction, purpose of visit, IA, documentation. Excellent. Suma, good evening. My name is Suma, one of the community health nurses working in this community health center. Darling, that's a very nice statement, but I would recommend you not to repeat community health services twice in your sentence. That's pretty lengthy, and also it can be tongue twisting. So avoid that, and we do not use the same noun twice in the sentence. Okay. So what you can do is, instead of community health center, you can, the last community health center, you can change that to here, or the first community health center, you can change that to I'm a registered nurse here. Okay. So that's enough. No problem. You don't have to overly concerned about it. Okay. Adira, greeting, self-intro, reason for the visit, initial assurance, ask name. Excellent. May I know the reason behind your visit, back channel, and initial reassurance? Excellent. Good job, Suma. Asha has mentioned, greetings, is it the right time to talk, reason for visit? Okay. So you don't have to do that, Asha, here, because this is not a home visit, or it's not like you're visiting the patient. The patient is visiting us. Okay, so you don't need to ask the question, is it the right time to talk? Okay, അത് ഇവിടെ suitable അല്ല കേട്ടോ. നമ്മൾ അങ്ങോട്ടേക്ക് കാണുമല്ലോ, ഇങ്ങോട്ട് വന്ന് നമ്മൾ കാണുമല്ലേ. So you cannot ask like is a good time to talk. Okay, Suma has mentioned wish, intro, find out the concern, back channel, initial reassurance, find the name, provide structure, info gathering. Excellent, that's a good point. I appreciate that effort to type everything. Okay, great. I appreciate your willingness to take the vaccine. Okay, in that context, if it is a vaccination context, you can give that point. Okay, so in this context, I appreciate your willingness to take vaccine is not suitable because if the patient is telling you, card alert, I'm just talking about the vaccination card. Imagine the patient came and said, my GP recommended me to take a flu vaccine, but I have some questions about it. So the patient did not say, I'm here to take the vaccine. അല്ലേ, ഞാനിവിടെ വാക്സിൻ എടുക്കാനാണ് വന്നതെന്ന് പേഷ്യൻ്റ് പറഞ്ഞില്ലല്ലോ അല്ലേ. അപ്പോൾ നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റില്ല. ഐ എം ഗ്ലാഡ് ടു ഹിയർ ദാറ്റ് ഐ അപ്രിഷ്യേറ്റ് യുവർ വില്ലിങ്നെസ് ഇസ് നോട്ട് അപ്രോപ്രിയേറ്റ് ബിക്കോസ് പേഷ്യൻ്റ് അവിടെ വന്നിരിക്കുന്നത് ഡീറ്റെയിൽ കളക്ട് ചെയ്യാനാണ്. Okay, the patient is not there to take the vaccine. So if the patient is there to take the vaccine as recommended by the doctor, then definitely you can use this point as an appreciation. But in this context, we can't. നമുക്കത് യൂസ് ചെയ്യാൻ പറ്റില്ല കേട്ടോ. സോ അതൊന്ന് ശ്രദ്ധിക്കണേ. Okay, Adira, empathize, offer help. Okay, Adira, yes, you did mention 2 points, which is excellent, but there is one more point. So when it comes to, I actually asked an initial question, what are the 3 components included in initial assurance? So the 3 components included in initial assurance, number 1, empathize, number 2, assure the patient, number 3, help, offer help. Okay, edukiyana, you need to empathize, you need to assure the patient, and number 3, you need to be telling the patient, don't worry, we'll help you. So offer help. So in this context, if I'm providing an empathizing statement, it would sound something like, oh, I'm sorry to hear that you're going through a rough time. I'm sorry to hear that you have some physical difficulties. Okay, my empathizing statement. Second, I'm assuring, but please don't worry, you are in the right place, my assurance. Third statement, offer help. I will look into it. I will help you, or we are there to help you. Okay, so this is called offering help. So these are the 3 points that you need to incorporate into your initial assurance. Okay, so yes, I'm sorry to hear that. Yes, Asha, that's a good one. Jibi mentioned, be empathetic if needed or appreciate. Patient is seeking for some details. Excellent. Jibi, reassure and then can offer help. Beautiful. So all of you understood these points. So these are the 3 segments that you need to incorporate. Fine. So now let's quickly look into the tasks here. So once you provide the initial assurance, now the next point is to explore details of the cramps. You have frequency, timing, intensity, and how it affects their sleep and quality of life. So I'm just going to construct statement. Please have a look into it. Okay. So the first one is, moving on, I would like to ask you some questions about the cramps that you have. How frequently do you experience the cramp? How frequently do you experience the cramp? Timing. Could you please tell me about the timing of the occurrence of the cramps? Could you please tell me about the timing of the occurrence of the cramps? Intensity. How bad is it? Simple as that. Or how severe is it? Could you please tell me about the intensity of the cramps? Or how bad is it? All these questions will be okay. And how it affects the sleep and quality of life. So is it affecting your sleep? But the patient says, it doesn't affect my sleep, but it disturbs my wife. Okay. And quality of life. So both the questions can be clubbed together. So does it affect your sleep or your life's quality? Or do you have any issues in your life because of these problems? എന്നുള്ള രീതിയിലൊക്കെ നമുക്ക് അവിടെ എക്സ്പാൻഡ് ചെയ്യാം കേട്ടോ. So once you get all the information, the next one is also about general health of the patient. So what you can do is you can ask the question. So I need to ask you some questions about your general health. Once you finish task number 2. So you have the first point, medications, fluid intake, exercise, diet. So you can ask the first question, do you take any medications? No. And do you drink enough water? Or what's your fluid intake like? What's your fluid intake like? Do you exercise regularly? Yes. And what about your diet? Do you have any particular diet? Okay. So once you got all the information, remember to give a summary, and also remember summary is also one of the points that is in under your parameters. So you have to summarize the collected information. So I'm just going to give a random summary. So just imagine these are the responses given by the patient. Basis and just a random summary. Thank you, Mr. Peter, for answering all my questions. So from what you told me, I understand that you do get these cramps frequently, and you don't know the timing, but most common it happens towards the midnight, and it is really bad at times. It is waking you from sleep, and yes, it is really bad at times. You don't take any medications, you drink enough water, you do exercise, you do follow a very well-balanced diet. Am I right? So this is how we can give a summary. Okay. Now, moving on to the next point, reassure the patient about vitamin mineral deficiency. Not a common cause in healthy people. Not a common cause in healthy people. So what you can do is you can explain the exact same thing what is given here. So I totally understand you're going to reassure about vitamin mineral deficiencies. Okay. So you need to tell the patient in healthy people, these deficiencies are not very common. So first and foremost, you need to bring to the point that you're talking about this mineral. Our topic like mineral vitamin deficiency in the question like namukang healthy you need to bring the patient to that point. So it is important that you create a situation where the patient is talking to you about the vitamin mineral deficiency. Okay, so what you can do is you can ask the patient a question. So Mr. Peter, before we get into further discussion, is there anything that you would like to ask me? And the chodichal patient will be like, yes. Is it because of any deficiencies that I might be having, like mineral or vitamin deficiency, because I read online that can be a cause? So you're getting a chance to explain and reassure the patient. Mr. Peter, I understand that you're really concerned about your present situation, and I can reassure you that if it gives you any peace of mind, I can reassure you that vitamin and mineral deficiencies are not a common cause in healthy people, and issues that you are experiencing right now can have other causes such as excessive exercise. It can be due to a muscle injury or fatigue. It can be even age related, and this is also seen in people when their muscle changes, and it's also a result of poor circulation. So there are multiple other reasons why you might be experiencing this problem, and from what you told me, I understand that you are a person who regularly exercises, so that could be one of the reasons too, Mr. Peter. I hope you understand. So Mr. Peter will like, yes, I understand. So what can I do about it? Well, please don't worry. I'll give you some management strategies. Please try applying ice packs, and you can do some stretching exercises and also try calf massage. That will make you feel better. I would also like to talk to you about some preventive measures. It is important that you do some gentle stretching before you go to bed, and warm baths is highly recommended. This will help you to relax your muscles, and remember to drink more water. I know you're drinking enough water right now, but make sure that you remember to continue it. And also, since you exercise every day, do not over exert yourself. Okay, keep everything in limited. Do not overdo anything, so that can cause these cramps again and again. So remember these points to prevent the occurrence of the cramps. I hope everything is clear to you. Do you have any concerns or questions? So the patient is saying, yeah, no, nothing else. I'm clear with all the points. So what you can do is you can encourage the patient to see the physiotherapist. Okay, I'm glad that I was helpful to you. However, I would recommend you to see the physiotherapist so that the physiotherapist can help you with this personalized exercise plan and also give you some guidance on what is a good and effective stretching that you can try. Okay, and having said that, I would like to remind you to come for a follow-up review if your symptoms continue worsen, so then we can have a detailed checkup and take it from there. Okay, that means checkup initiation namukku vendana കാര്യങ്ങൾ ചെയ്യാം എന്നുള്ള രീതി പറയാട്ടോ. So that is how you can complete it. So then you are telling the patient, so is there anything else I can help you with? Then the patient says nothing else, so you can reassure one more time. Okay, so do I want you to connect with the physiotherapist right now? So the patient says yes or something like that, only because I just mentioned or encouraging the patient to meet the physiotherapist. അപ്പോൾ ഞാൻ എന്ത് ചെയ്യണം, കൺക്ലൂഷനിൽ ചോദിക്കണം, so is it okay if I connect you with the physiotherapist? So she says yes or he says yes. So what you can do is, okay, so please wait here. I will let you know when he is here, or I'll let you know when he is available, or I have passed on the information. Be creative. You can say I have passed on the information. He will be meeting you in 15 minutes. So please wait here. That's enough. Okay, so give any random conclusion which is related to the context that you're dealing with. That's the only point that you need to remember. Okay, that's the only thing that needs to be in your mind. Okay, so that is how you can do this task. Pretty easy, alle? Paranju vannapol, yes, this is pretty easy, but it only we can only say it's going to be very easy only if you are able to present it without much hesitation, without much searching of words. ആ ഒരു രീതിയിൽ ചെയ്യാൻ പറ്റിയാൽ മാത്രമാണ് നമുക്കത് ഓക്കെ ശരിയാണ്, ഈസി ആയിട്ടുള്ളൊരു കാർഡാണ്, അല്ലെങ്കിൽ ഈസി ആയിട്ട് ചെയ്യാൻ പറ്റുന്ന കോണ്ടെക്സ്റ്റ് ആണെന്ന് പറയാൻ പറ്റുള്ളൂ. സോ റിമെമ്പർ ദാറ്റ്. ഓക്കെ, ട്രൈ ടു ഡു ഇറ്റ് വിത്ത് 2 different people and see whether you can speak easily without much hesitations or much hindrances, whether you can construct the statements without any much issues. Okay, and see for that. And for those who want the sentence constructions, please rewatch this live, pause the areas when I am constructing the statements, and then take it from there. Okay. All right, yes, so let me see some of the statements here. Yes, good evening, Sri Kumar. Before proceeding, I would like to ask you some questions regarding your cramps and general health. Then I can provide to you, to provide you the possible management options. In between, if you have any queries, please feel free to ask me. May I proceed, Mr. Peter? Yes. Second task, patient already told he feels at night. Then how can we ask time? Timing. Timings means like... നൈറ്റിൽ തന്നെ എത്ര മണിയാവുമ്പോൾ അല്ലെങ്കിൽ ഉറങ്ങി കുറച്ച് കഴിഞ്ഞിട്ടാണോ എന്നുള്ള രീതിയിലാണ് നമ്മൾ ചോദിക്കുന്നത് കേട്ടോ. സോ അവിടെ കിടക്കുമ്പോൾ തന്നെ വരുന്നുണ്ടോ, അല്ലെങ്കിൽ ഇത് റെക്കറൻ്റ് ആയിട്ട് സംഭവിക്കുന്നുണ്ടോ എന്നൊക്കെ ഉള്ളൊരു കോണ്ടെക്സ്റ്റ് ആണ്. ഓക്കെ, yes, so I hope everything is clear to you guys. So please make sure that for the sentence constructions, to take a note of it, rewatch the live point whenever starting from the point that we are discussing the card. Ningal pause cheya ennitte adu ezhuthi edukka, and when I say you have to write it down, I'm not recommending you to write it down and memorize every word of it. See how the sentence can be constructed, and then try to use it as a reference to construct your own statements. Okay, that's what I am intending to say. So please don't mistake me for like by hearting the points. Okay, I'm not a fan of by hearting or memorizing anything. Don't do that. I don't encourage it. But what you can do is you can take all the sentences as references and then try to speak by yourself by constructing statements. Okay, so yes, so that's for today. I hope everything is clear to you guys. I hope you got an idea about how this card can be done. So I'll be coming back tomorrow with another discussion, and also we'll be looking into another role play card tomorrow. So until then, take care. Okay, good night all of you. Bye bye.